All right, we're gonna call the meeting to order, and can we do roll call?
Yes. Member Barish? Here. Member Riley? Member Ebram?
Here.
Member Daughtery?
Present.
Member Antle?
Present.
Member Allman?
Here.
Member Mojetti?
Moschetti, yes.
Moschetti, okay, I blew it. Spaghetti, all right. And Member Bradley?
Here.
And Chair Miller.
Here. All right, we're going to start with public expression on non-agendized items. Do we have any public expression on non-agendized items? All right, seeing none, we will move on to committee matters. We will start with approval of the minutes from the October 25th, 2023 regular meeting. Does anybody have any changes, questions, comments?
I move approval.
I'll second.
Do we have any committee member comments? All right, any public comments? Hearing none, we'll do a roll call vote.
Member Barish?
Yes.
Member Ebram?
It's Ebiam.
Ebion, sorry about
That's all
that.
right. I just figured I'd cut to the chase. Yes.
Member Daughtery?
Yeah, it's Doherty, and yes, it's okay.
Okay, I'm doing terrible here. Okay, Antle?
Yes.
Allman?
That was perfect, yes.
Well, yours is easy. Moschetti.
Moschetti.
It's all good.
Yes.
Moschetti, all right. And Chair Miller.
Yes.
And I forgot Bradley. Member Bradley, okay.
All right, before we move to the Measure B financial report, I just wanted to make sure the committee knows we have 2 new staff supporting the committee. Sorry, Kathy. So I definitely, please have patience. They are doing this for the first time. And so Claudia and Kathy are currently the new staff that will be supporting this committee going forward, and also supporting the administration for behavioral health and public health. So I just wanted to make sure we introduce them, and please know they're doing the best they can with names, so get them.
Thank you both.
Terrible.
Thank you, Kathy. All right, so we're going to move on to 3B, December 2023 Measure B financial report, and I'm going to hand that off to Mary Alice. I do want to just let everyone know that Mary Alice is retiring from the county after 22 years on Friday. And so I want to make sure everyone knows that, and she will be handing the torch over, and I'll let her do that introduction, but I would just wanted everyone to know we are losing her after 22 years, so it's going to be a loss to us.
Is this your last meeting?
Yes,
Oh,
yeah, my last day is Friday with the
such
county.
a magnificent job.
Yeah, thank you, Tom. Our committee on Okay, so in the reports that you guys have in front of you today, your revenues posted through September, and we've, for Measure B sales tax, we've received a little over $49 million to date. Also in the expenditure report, I did add on page 2, number 4, I included the new behavioral health wing correctional facility loan in the amount of $7 million. So with that loan included, if you look at the bottom of page 3 of that report, it's going to show that our estimated unallocated capital facility funds currently reflects a deficit of $633,000. But of course, that number should be, once we start receiving our grant funds and repayment of the loan, we'll see that offset.
So the money already been transferred?
It hasn't been transferred, but I put it as an approved project because the board did approve it. So I
But
put it.
we're still collecting interest on it where it sits.
Yes,
Okay.
yeah, we're still collecting interest, and as, once the loan is, we'll be able to, once the loan is made and there's any payments going back, they'll be reflected in this reports moving forward, so.
Yeah, and
Yeah.
sorry.
Oh, no.
The board action does require that the interest be paid even after the money is used for the loan purpose. So the general fund will be paying interest on any loaned amount.
There hasn't been a lot of activity as far as expenditures. We've had some of the bills for the demolition of the Whitmore site. And so there hasn't been a lot of activity, but if there's any questions on the reports that you guys have today, I'm happy to answer those. Yes?
So,
Sherry.
under the, what I think of as the compilation, I think it's, the compilation of, on the page that's, the title is Measure B Operational Costs, but I'm looking at the bottom portion where under the capital facilities, the 75%, bottom line there, it shows a negative 633,000.
Correct.
So where's that money coming from?
Well, it's, again, that is to do with everything that's allocated. So we still have the funds there. It's just once, if we were to spend all the allocated funds and nothing else was, to be able to offset those, we would be in a negative, we would be in the negative. But however, with the grant that we've applied for, we know that we're going to be able to get some reimbursements on that. I'm confident that we're going to be able to get reimbursements on that. And then also, once the loan is paid back, that'll offset that. Again, we're looking at allocated funds, not what's been expended to date.
Right,
Yeah.
right, right, just allocated. So, just on paper anyway, if we had to be able to say to the public, where's the money coming from? I mean, it shows a negative balance. At this point in time, would it come from the reserve then?
Oh, it could come from your reserves, if that's what was.
Push comes to shove?
Mhm.
Okay.
But I just want to make sure I understand this. You've already taken away the money for the Whitmore project.
Correct,
For the building of the Whitmore project, that won't be done for another 3 years.
correct.
So the money is, what you're saying is, if all of our projects were done and we got a bill for everything and we paid them, then we'd be there. But we all know that we're 36 months away at least from seeing the doors swing open at the new PUF. So the money isn't just going to be given to the contractor all at once, it's going to be paid. And as we're waiting, that's when the $10 million grant, the $9 million grant will be coming in and so forth. So,
Yes.
thank you.
Are there any other questions on that?
Because all these numbers are under projected
Yes.
expenses.
Estimated and,
Yeah.
yeah. And I mean, once they go out for the RFP, I mean, that number could change for the new PUF unit. But,
Plus, our contingency fund is very healthy.
yes,
And if we said we didn't have a contingency fund, that would certainly be a negative, not a negative number. That would be a very, very high positive number.
yes, it would.
Thank you.
Are you calling?
Can I ask if you could tell us who your replacement is?
Well, that was going to be my next thing.
Sorry,
Yeah,
I jumped
no.
ahead.
I was actually going to announce that I was retiring, but Janine did that for me, so I won't do that. But I'm May Payne, who is Behavioral Health's brilliant fiscal manager, is going to be assuming my role for Measure B, doing the finances, and I'm leaving you in really good hands. She is brilliant. She spins circles around me, so I'm excited to have her as the replacement here. So she's really young too, so she can spin lots of circles around me. Very energetic.
Personally, Mary Alice, I'd like to thank you.
Oh,
Thank you very much for the work you've done. You've cleared a lot of things up, And your reports, in my estimation, are very good. Thank you very much for your service.
Yeah, well, thanks, and I have to say that I've enjoyed supporting this committee, and Sherry and I meet regularly, and we've done some good brainstorming sessions that have helped me understand everything that from the inception of this tax initiative. So I've appreciated the opportunity to support you guys.
All right, any public comments? All right, hearing none, we will move on to 3C. Update and discussion regarding Measure B related items at the Board of Supervisors meeting. Quick update, I think most people probably know that 2 items went in front of the Board of Supervisors. One was to fund the RFP for 4th Street to expand sober living, and that did not pass. And then the other item was to fund a loan or some type of funding of Measure B funds to support the construction of the jail behavioral health wing project. The board did move forward with funding the behavioral health wing project with, as we've spoken about already here, with a loan. And so more information about the loan will come forward as more information is available. As it has been pointed out, there will be interest paid on those funds. And we are looking, I know the county is looking at other funding streams to also fund the jail, so that maybe it won't need to be Measure B funds, or maybe it'll be less than $7 million that needs to be looked at. There is some additional state funding that's being looked at, and also some additional grant funds that we've put in questions to see if that's an option to support the remaining construction for the behavioral health wing of the jail. So those were 2 items that went in front of the board. A third item that has gone in front of the board that kind of overlaps with Measure B was a decision regarding the Behavioral Health Advisory Board. And that decision was to downsize the Behavioral Health Advisory Board from a 15-member board to 11-member board, with a recommendation to look at, is there 5 people from this committee that could also sit on the Behavioral Health Advisory Board, so there might be more connection between the 2 boards, and then to have a connection that these meetings and the Behavioral Health Advisory Board meetings meet on the same day, so that if there are members on both committees, it makes it easy to go from one meeting to the next meeting. There's a resolution that went in front of the board on Tuesday to finalize that decision, and I think some of the Board of Supervisor members may be reaching out to their constituents on this board to see if they're interested possibly serving on the Behavioral Health Advisory Board. Behavioral Health Advisory Board does have some stricter requirements, so you cannot be working for an agency that has a contract with behavioral health. And you can't be a member of the staff of behavioral health to sit on Behavioral Health Advisory Board. So that does eliminate some of the members of this committee that could also serve on Behavioral Health Advisory Board. But I wanted to make sure you guys knew that went forward, and I'm assuming if there is a request that your Board of Supervisor member will reach out to you and discuss that with you. And I think we'll hear more about it in January, February, as the board makes decisions on the makeup of Behavioral Health Advisory Board. As we know, Joe sits as a member of Behavioral Health Advisory Board currently, sits on this board and Behavioral Health Advisory Board. So that's my update on those 3 items. Any comments?
Oh, wait. I mean, the voter pass initiative clearly says there will be a representative from the Behavioral Health
Right.
Advisory Board. So it's not going to affect Joe.
It will not affect Joe.
Can we say who else is going to affect?
That depends on if there's other members from this board that want to sit on Behavioral Health Advisory Board. It's not a requirement.
So it's not going to affect this board?
It's not going to affect
Okay.
this board.
Thank you.
Yes.
So I have a question. I thought I heard you say the board, it did not pass to fund 4th Street. So was there discussion? What was the discussion that went on? Was there any?
I was not at that meeting, Sherry. Unfortunately, I was out, so I can't speak, but I think Supervisor Haschak is coming up
Oh,
to
good, okay,
answer your question for you.
thank you.
Yeah, there was quite a bit of, John Haschak, 3rd District Supervisor. So there was quite a bit of discussion about it. Remember that the board had appointed an ad hoc committee to look at the funding for Measure B and how it would affect Ford Street. We came back after meeting with many of the stakeholders and presented to the board what the financials were as we saw them. And the board's discussion centered around, whether we had, with so many things going on with the PUF and overruns and all that, if we had the financial capacity to fund Ford Street at this point. And the decision of the board was to not fund it, as Dr. Miller said.
So if the funding became available, would that imply that the board might fund it? Is that an inference we could make?
I think it could certainly be reconsidered, right?
And you said there was an ad hoc committee to look at the funding. I know there was an ad hoc committee to look at the RFP, but I wasn't aware of an ad hoc committee to look at the funding.
Well, the ad hoc committee was from the Board of Supervisors, so it was Supervisor Mulherin and myself. And we looked at the financials, we met with Mary Alice and presented what our findings were.
Any other committee comments, questions? Any public comments, questions? All right, we'll move on to item 3D, status and discussion regarding the current Measure B projects. You guys have a report on that, and so if there's any questions regarding that, I can answer those. I will just note that I think the biggest thing that's probably of question is the behavioral health, psychiatric health facility. So we are still working with the architect and the construction management to finalize the plans. They're kind of in the last phases of getting those plans finalized and working on getting it out for bid for construction. They are hoping to have that out by spring, and then I know they are hoping to start construction next year of that facility is the last update I have, so that's exciting. We have been working with our grant, the $9 million grant, to make sure we get that all in place. We still have to, we've had them work with us to really make sure we don't, which we're very thankful, we don't have to have a cash match by using the property and some of the expenses we paid up front. We had to have a cash match. But the good news is that based on the property amount and prior expenses we've already put to the project, they've zeroed us out from having to have any additional cash match to get the $9 million. We still have to jump through all their hoops. So it doesn't mean we don't have hoops to jump through, and we still have to meet all their legal requirements. So we are going through all that process. We were able to get approval to, as soon as the contract signed, to start being able to submit invoices towards some of the expenses that are after July 1st, because that's when we have to submit it for after the award amount. So we're hopeful that we've been told yes. So we're hopeful that we will be able to start submitting some invoices and possibly see some reimbursement from that grant starting as soon as our contract is signed. So some good news on that. We're hopeful that with the state proposed deficit that our grants are not impacted. So we're hopeful to get some invoicing in and get started on collecting on that grant as soon as we can. Yes.
Can I ask, you said once the contract is signed, when do you foresee that, please?
It depends on the state. We're at the state's mercy. At that, we were negotiating the cash amount, which held up our contract. So we have to do the scope of work. So part of that scope of work was determining whether or not they were going to agree that we had met our cash cash amount or not. And so they just recently said yes. They just approved us to say yes. So hopefully in the next month or two, but it's up to them to get us our scope of work signed off on, agree to it, note that we met our cash match, and then it will go for county council to review, and then it'll be signed. We already went to the Board of Supervisors to accept and allow signature on the grant, so really we just want to make sure that we get the correct scope of work. They've noted that we've met our cash amount and that county council is in agreement with the terms.
So 3 months.
Yeah. It's all dependent on the state turning it around to us.
Thank you.
Any other comments, questions? Any public comments, questions? All right, we will move to 3E, discussion and possible action regarding the Mental Health Treatment Act Citizens Oversight Committee meeting calendar for 2024. So we did put together a meeting calendar for 2024. And so if there are any questions or concerns, please let me know. We were planning to look at, I believe, the June or August meeting to have one meeting in the coast. And we'd like to plan that ahead of time to have a coastal meeting this next year. And so that is something we were looking at for June or August, but we need to also coordinate that with the Behavioral Health Advisory Board, and they're willing to coordinate with whatever meeting you guys choose to have in the coastal area.
I would suggest August because it's hotter here than it is there in August. August is really hot here compared to June.
Tom, did you?
Certainly August is a great time to, or on the coast they call it Faugust, but yeah, we could meet on the coast then. I want to remind the board of a discussion we had 2 years ago. And 2 years ago there was a discussion, actually I think Harmel is still the CEO, of we were meeting monthly and someone said we should meet quarterly, and we negotiated to meet every other month. And one of the reasons that I did not want to meet quarterly at that time and I wanted to meet at least every other month is because we were still in the first 5 years of Measure B where we were collecting the majority of our sales tax, and we hadn't committed to the PUF, we hadn't committed to the crisis units and so forth. And so the rationale to meet every other month was we still had many things that were in motion that we as a board, as a committee, could make recommendations to the Board of Supervisors, and maybe this needs to be an agendized item for next month, next meeting. Maybe we are at the point, since our money has been committed to projects and we're merely overseeing how the projects are moving along and there's not major decisions being made, maybe there should be a time that we should readdress meeting quarterly instead of every other month. I hope I didn't sound like a word salad there. But I'm not saying the majority of our work is done, but the majority of major decisions are behind us right now. So I will let the chair decide if this is going to be an agendized item or if we could vote on it today, since the agenda item is to talk about next year's schedule.
So as long as county council, yes, we're good to go. Joe? Donna?
No, go ahead, Jill.
I was just going to say, until we actually break ground on the PUF, at least for the next year, to stay on every other month, and then after that I completely see it. But once this thing gets ground broken, I think we just need to be close by and then let it go.
I'm not going to disagree, and that should happen in 2024, according to the chair, right?
Yes.
That's what I'm saying, so that would mean we'd stay every other month for the following year.
I'm all for it. Thank you.
Donna?
I agree with both. However, I think we could do it quarterly. The PUF is on its way. It is going. We have no, to my knowledge, and the chair can correct me if I'm wrong, we have no further standing in the PUF other than small things that I know of. I would personally be fine with going quarterly. That's just my opinion.
I would also agree with going quarterly. I think at this point, it makes sense.
My feeling is the PUF is budgeted at least 19 million. It's such a huge amount of money. I agree with what Joe was saying, that until we really get going with that and have a stronger sense of what will unfold with that, including operational costs, to continue every other month, just for one more year.
The other reason I suggested that is right now I'm in charge of a building that's being changed from assisted living to residential. And I cannot tell you how many times something came out of the blue and we had to shift gears and go someplace else. It's taking an inordinately long time, both getting stuff through the county as well as getting through a committee. So I'm just trying to be careful. Not that I don't trust Janine, but that was where I'm coming from.
Yeah, Donna.
And I appreciate that totally, but how much, and I guess this question, I don't know who it's addressed to. It's either addressed to county council, the CEO, or Dr. Miller. How much do we have to say as the Measure B committee as to what is going on moving forward towards the PUF? If we have things we can say, and I can ask the Board of Supervisors too, then I'm all for every other month. If we don't have anything else that we can actually have input in, then I'm for every quarter. So I guess I'm asking, and I don't know who is the best to answer that question. I'm sorry. I should know that, but I don't.
So I might look a little bit to the CEO and the department head, but typically in these sorts of situations, once all of the contract approvals are done, it becomes very operational at that point and becomes staff that's handling most of the the day-to-day components on the construction. If there's any major amendments or project changes, that might go to the board, and then that's the sort of thing that this committee might advise on. But for the most part, I think all of those major steps have been done already.
Thank you, Chair Muschetti.
I'm not chair.
Dawn. Yeah, I agree with County Council Curtis on that. And I would recommend quarterly meetings. If something's needed, you can always call a special meeting to bring people together. But again, thinking the majority of those decisions has been made and provided by this group.
Any other? Tom?
Well, I'm gonna ask you a question.
Sure.
You're gonna be chair next year, correct?
No. Sherry is.
Chair.
My 2 years are done. This is my last meeting chairing.
Okay, last meeting. as chair.
Chairing, yes, chair, as chair.
So let me ask the committee here. I've heard all the points and I agree with them, but I'm still for quarterly because we have made our major decisions and we've sent them on to the board. And I'm asking us, can anybody think of a major decision that we are going to be faced with next year? I know we can't predict the future, but we're going to be faced with next year that deals specifically with the 75% of the brick and mortar or the 25% of the services, because those balls are in motion. So if somebody has a grand idea, you'll find me rah-rahing you and supporting you, but I think we've made those decisions.
Well, and to CEO Antol's point, we can always schedule the 4 meetings, the quarterly meetings, and if there's really an urgent matter that's referred to us by the board, we can call a special meeting. That's always a possibility.
I think there still is really one piece that still hasn't been completely addressed. I know the board did not fund Ford Street. I'd like to think that project is not, what's the expression, dead in the what? In the water? Whatever it is, that it's not dead. And over the next couple months, as we hadn't seen the proposal for the jail to pay back the loan, how will that affect a possible funding of the jail? I certainly have some other ideas not the funding of the jail, funding of Ford Street. I have some other ideas I would love to propose about still trying to fund Ford Street. Our Kemper report said 10% of our funds should go to substance use disorder treatment. And Ford Street's only one piece. We haven't funded organizations that provide post-Ford Street care or pre-Ford Street care as well. And I think those are still important things to talk about. So that's why I think staying on this schedule is still a better way to go.
Joe,
Thought
she said to
ahead,
let you
man.
go.
I was just going to suggest, looking at the calendar that you've presented us, why not do February and April, and then go to quarterly after that, presuming ground has been broken and we can have discussions about these other things?
I wouldn't assume ground will be broken by April, because the bids will be going out in spring.
Oh, okay.
But I'm not saying no, I just want to make sure clear. If bids go out in spring, they'll be going out in March, April, and it'll take some time.
All right, so what I'm thinking is if there's anything more that we want to entertain, like Sherry just mentioned, then we should do that in February or April and then just go to quarterly from that. So the first quarter, we would do our normal and then go from there.
Donna?
I'm going to make a motion, and I'm going to make a motion, well, wait, I'm going to say before I make the motion why I'm doing this. Number one, the board has made decisions, and they're probably going to stick with them, and whatever we say, they will take an advisement, but they're going to do what they wish to do. I am going to move that we go to quarterly in 2023. 24. Oh my God, I don't want to be older than that. I'm too old already. In 2024.
Is not what you want either.
Why not? I'm just going to crawl in the crypt and forget about it.
I second.
I'm sorry, who made the second? Thank you, Lindsay.
All right, any other committee comments?
I want to just weigh in on this and say one of the most important things we may not do this year, because it's already been done successfully the last couple of years, is our budget. And our budget has to be done by June 30th. So if we go this route, which I'm in support of, there's going to be pressure on the former chair, in February we'll say former chair, of making sure that the budget is a publicly addressed discussion and not something that is just put on the board agenda without us as a representative of the voters doing it. So how would you be able to, if we met quarterly, it's going to change many things, because it's going to be, what are we going to meet March, June, September, December, or what? But how do you feel with the budget and going quarterly?
Well, we all, those within county know we have to submit our budget way before June. So we're already working on budgets early spring, right? So I think that if we had a March meeting would be easier than a February on us, but if we went February, we could have, it's a pretty easy budget to prep, so we could have something prep for February or March. March I think would be a little easier, but we can prep something for either, we can bring the budget here in February or March.
So to the maker of the motion, I would just add that you include what was the CEO talked about in the motion of saying, but if something of significant comes up with the chair, then a meeting with at least 2 weeks' notice.
Okay. So I will amend my motion to state that we go is not the correct English, but that we meet quarterly with provisions to have emergency meetings at any time via request of any committee member. Because that, I believe, is the correct, don't add that, but that, I believe, is the correct way to phrase it. Is that not?
So just a few things in terms of phrasing. One is I would say special meeting rather than emergency
Okay.
meeting. And then it would be the chair that needs to call it, but you could indicate that the expectation of the committee is that the chair would call it at the request of any of the committee members.
Okay, you got that?
I think so.
Okay, could you read it back to me, please?
Okay,
I did.
the motion is to meet quarterly with provisions for emergency,
Whatever he said.
for special. Okay, let me start again. The motion is for the committee, the oversight committee, to meet quarterly with provisions to meet for specified meetings at any time at the request of the chair or a committee member.
Just as a chair, because they'll do it by a committee member.
Okay, could you say that again?
Is it all right if I take a stab?
Yeah, you throw it.
Yeah.
You take it.
I believe the intent of the motion was that the committee would move to a quarterly regular meeting schedule with the understanding that the chair will call special meetings at the request of individual committee members.
Okay.
Can I throw something in that?
As soon as I have a second.
Yeah, the second agrees. All of this is in alignment with Brown Act standards, so yeah, it all makes sense.
Well, I'm wondering if you might add, even though Joe already brought it up, that we have our February, that the quarterly meetings begin in June. I just feel the PUF is such an enormous project. And it's not half our money, but it's almost half of our money. And to suddenly disband for quarterly meetings doesn't feel like good oversight. That's all. Doesn't feel like good oversight.
Chair Miller, as the director of these projects moving forward, will you be continuing to provide your regular monthly written reports?
Yes, so the regular monthly reports will go out as they have. So you'll get your monthly reports, and then you'll have the report brought to this meeting. Any public comments? All right, do we want to do a roll call?
Just to confirm, we're not starting in February, right? We're starting in March.
Is that in the motion?
No, it's not.
Actually, it wasn't.
We haven't talked about the date yet.
Yeah.
Well, but a quarterly meeting, quarterly, we can just do it right now.
We can do that, yeah.
Yeah, if I'm not mistaken, council, please let me know, we would vote this in and then approve a calendar.
Yeah,
Is that correct?
your choice, but if it may be easier to vote on the concept of quarterly and then set the
Put it
calendar.
in, okay.
Okay, so can we do a roll call?
Yes. Member Barish?
Yes.
Abugyam, is that correct?
That's close enough.
Okay. Daughtery?
I didn't tell you my vote.
Oh, I'm sorry.
No.
No, okay. So, okay, Daughtery?
Yes.
Antle?
Yes.
Almond?
Yes.
Moschetti?
There you go.
Yay!
You got it, yes.
Bradley?
With that extra provision, yes.
Okay, and Chair Miller?
Yes. All right, so we need to go back to discuss, do we want the quarterly meetings to start in February or March? I think I'm hearing March. So do we have any committee discussion on them starting March? So it would be March, June, September, December would be the dates if we did them quarterly. Yes.
Chair Miller, I would recommend March and then an earlier meeting in June, so you can come back if this board had any more input on your budget before you presented the final budget, or maybe you do March and late May.
March, late May, okay.
Which end of May?
So there's some inconsistencies here, so
Yeah.
we've always met on the fourth Wednesday of the month, is that correct?
Yes, that's correct.
Okay, so let's look at, on March, so we would meet on the
27th.
27th, okay, I'm sorry, all right.
But what member Antoine was saying is that because we would want to be able to give feedback to the budget if we made any changes in March, we would want to meet in either May, which would get us off our quarter schedule a little bit, or early June. So we may want to, because we want to see the budget, it might be easier to meet in February, and then we have February, May, because we can prep that budget early. It's a pretty straightforward budget. So if we meet in February, it would be February, May, August, November. That gives us time to bring the budget in February. If you have recommendations, bring it back in May and finalize it in May.
Okay, so say the dates that you're looking at.
Yeah,
I mean,
so-
the month and the date,
Okay,
please.
so you'd have February 28th, you'd have May 22nd, that would be the 4th,
Okay.
August 28th, and then September 27th. November 27th. That would also make it easier. I know sometimes we have it late in December, which impacts people's holidays.
So November 27th, isn't that the day before
February.
Thanksgiving?
No,
No,
No?
No, Thanksgiving's the
Thanksgiving is the
21st.
Isn't it the 4th?
No, it's
Oh,
the
the third Thursday?
it always
I thought it was
changes.
the 4th.
No, it doesn't change.
No, I thought it was the 4th Thursday.
I think you might
It
be
is
right.
the fourth Thursday, so it would be the 20th of
Yeah.
November.
Oh, Thanksgiving is on Thursday, November 28th,
Yep, it would be the
2024.
so we can do the 20th.
Yeah, it's the same as we do all the time in November and
Yeah.
December.
Like Easter.
So
So
we-
that would be the 20th?
The 20th. So it'd be February 28th, May 22nd, August 28th, and then November 20th. And that gives us time for the budget.
Right. And we can still do the meeting on the coast in August.
Yes, we can do the meeting on the coast in August.
And that's part of the, so I'm gonna make a motion that for 2024, the Measure B Mental Health Treatment Act Citizens Oversight Committee meets quarterly on February 28th, May 22nd, August 28th, which will be on the coast, and November 20th.
I'll second that.
Joe?
Brad?
Joe Bradley. Yeah, you had the easy ones, Alman and Bradley.
So let me ask the question, is this amending the original motion then?
No.
This is a separate.
Supplemental.
Separate, so there's two motions?
Yes.
Okay.
All right, any committee comments, questions? Any public comments, question? All right, seeing none, can we do a roll call?
Member Barish?
Yes.
Ebyom?
No,
No. Okay. Daughtery?
Yes.
Antle?
Yes.
Holman?
Aye.
Moschetti?
There you go, you get it the second time. You're
I
good.
know, I'm getting better.
Yes.
Okay, Bradley
Yes.
and Chair Miller.
Yes. All right, 3F is an update and discussion regarding the long-term financial report.
Can I ask one question regarding the calendar
Yes.
before you go forward?
Sure, yes.
What time are we doing this?
Same time, 1 to 3.
Okay. Thank you.
Okay, 3F, update and discussion regarding the long-term financial plan. And Sherry, this was an item you asked to have.
yes, so I put together something, that we can look at, and just because it's always easier instead of hearing you, I like visuals. So there's copies here, I'm just gonna, I don't know, there's 12 copies here. Without everything, share.
Yeah, not every day, not every day.
Make sure, Lindsay, can you make sure they have to add one to the packet? And we're gonna have to upload it. Here, Joe. Joe. It's just one staple.
There's a couple of extra.
All right, Alice, it looks like Sherry needs a copy. We'll have to share.
I started out the first page with the PUF, only because in terms of the long-term financial plan, it's a huge expense, or it could be a huge expense. And we currently have, in the current budget, we have, under operations, we have 1.8 million budgeted for the PUF for 1 year. So with the expectation that it would cost $1.8 million to operate each year. So if this first page is wrong, I'm just using information that I've gleaned over the years that this committee has met, and I'm sure there's parts of it that are wrong. But this is what I had to work with. So my understanding, I'm going to go through this, is that the PUF has 16 beds. And if the vendor was to charge us $1,200 a bed, which is a number that I heard thrown out at one point, times 365 days, it would cost a hair over $7 million to run, or that would have to be paid to the vendor. Mendocino County, we would get reimbursed, our out-of-pocket costs would be 40% because 60% is reimbursable. So I did the same calculation, times 40%, that $2,102,000, that would be part of the payment of that $7 million. The next part, there was talk about possibly selling 4 beds to other counties, including, and instead of $1,200 per bed, upped it to $1,344 for a 12% service cost for overhead costs to run the PUF, not necessarily care costs. So that could bring in $1.962 million toward that $7 million. And then the third source of revenue would be Medicare reimbursement for the 12 beds. And my understanding was that Medicare would reimburse at 60%. So those 3 sources of funding add up to $7,218,000. And the cost to the vendor is $7,008,000. So there's excess available to reduce the cost to Mendocino County, so it would cost us a little under $1.9 million. Then I went from there in my thinking and thought, what I understand about Measure B is that costs for services, Measure B is not supposed to supplant cost for services. We're supposed to expand services, provide, an expansion. And I remember, this is a couple of years ago, that when we talked about how much are we paying to send patients out of county. And that was part of the motivation to want to build the PUF. And the number 1.9 to 2 million was what was thrown out. So this scenario shows the county spending 2.1 million plus depreciation costs, blah, blah, blah. But if the county is currently spending 1.9 or 2 million to send people out of county, then these costs are not additional costs. They would be paid for mostly by the costs that the county currently incurs by sending the patients out of county. So, I want some clarification on that idea about supplanting versus expansion, because my understanding is that the county does spend money to spend patients out of county currently, because we don't have a PUF. So that's the first page.
Can I ask a question? Mm-hmm. You're saying we're gonna sell 4 beds to other counties.
Right.
Is that something that was already decided?
It was
Because
told-
how many beds do we need average on an annual basis? Are we selling 4 beds that our county would use? I mean, I know we're trying to offset some damages financially, but I don't wanna cut off our nose to spite our face.
All right, so I'm assuming you're asking me that, Joe.
Well, I'm kinda looking at you,
I
because you
noticed.
probably know the numbers.
I noticed. So, first of all, we don't bill Medicare, we bill Medi-Cal.
Okay.
So that's number one. And Medi-Cal is not 100%, a 60% match when it comes to psychiatric health facilities, even though we talk about it as a 40-60 split in regards to most services. When it comes to inpatient facilities, crisis residential, it's a set fee. So it's based on the type of facility, it's a set fee. And as you know, our world changed with CalAIMS and payment reform as of July 1st. So how we used to bill and pay is very different than how we bill and pay today. So it's a apples and oranges system that has changed as of July 1st. So you can't guarantee that it's a 60-40 split. The 40% split is what we pay. So that 40% split is what we pay. When you put 1A, that 12 beds at 2.1 million, that is what we pay out of pocket. We wouldn't be paying additional. That would be expansion, not supplantation, right? So the 2.1 is the 40% that comes out of our county realignment dollars, our 1991. So also 1,200 is very cheap. Currently, I think one of our cheapest facilities is 1,365. And so that tells you how much we pay out of pocket, and then you have to look at that. Also, what's not embedded in here is that you have indigent cost. So you're including that everybody has Medi-Cal and every bed will be paid for, but we have a portion of our population that has no insurance, and therefore it comes straight out of county realignment dollars. So you have to input that in. In regards to the selling of the beds, there have been models across the state of California, old models, not current models you see as much, where some counties have asked to buy a bed so they have a bed 24/7 because of the challenges of finding beds across the state of California. It's not a model that I see as much anymore. Back then, even Mendocino County, several years ago, probably 10 years ago, we bought beds so that we always had a bed because it's hard to place. So there is a model where some facilities will buy beds, something that Sonoma and Marin County did when Sonoma opened their new PUF in Sonoma County. They went in with a partnership with Marin County. Sonoma County got so many beds, Marin County got so many beds, so they sort of sold the beds, but it's like a partnership. So there is a model where you can sell beds to other counties and they have the rights to those beds. Does it impact our number of people needing a bed? It's possible. I'd have to rerun the numbers because I don't want to give a number, but you're looking at number of people going in, number of days they stay within a facility. So how many days, number of people, and then we really need to look at not just Medi-Cal. A lot of times we look at just the Medi-Cal population, but because we're building a super PUF with the ability to potentially take Medicare and private insurance, that would change the numbers we consistently look at. So I could do an analysis and then bring that back of how many people we have on a given day in a facility, but remember it fluctuates. I could have 16 today and 9 tomorrow, right? So it depends on the need for the facilities. Does that answer your question?
Yeah, it's still nebulous, but yes, it does answer the question.
I don't want to give you a number that I don't have in front of me that I haven't calculated in the last month or two because that would be,
I don't want you to give me something that you can't.
yeah,
I
I'd
just-
rather bring it back.
I wanted to think about that because I would hate to sell these beds and then need them for our own people. That's where I was going with that.
Sure, I have a question, and this has come up through you before because you're the most knowledgeable person with reimbursements. But Medicare certainly pays the majority for services for the behavioral health department,
Medi-Cal,
Medi-Cal. And private insurance does not.
correct.
So this PUF we're building, is someone with private insurance going to be able to go to the PUF?
So that's the plan. I mean, so here's what I will say. Yes, but the thing with private insurance, right? We can't make them take our facility. So we're building it to meet the standards of Medicare, which generally meets the standard of 90% of private insurance providers. The issue with private insurance is the private insurance company has to want to contract with us. So if your private insurance, just like recently Blue Shield doesn't want to contract with Aventis, right? We're hearing that, right? So people are concerned, right? So Blue Shield could say, no, I won't contract with that facility. It's up to your private insurance company whether they will contract with us. We have no control over that. As long as the facility meets Medicare standards, Medicare is really good at contracting with facilities, just like Medi-Cal. So I don't see Medicare being an issue. But with private insurance, it's up to the insurance carrier whether or not they will want to work with that facility or not. We will push for it, right? We're going to push that they do because it's closer, it's better for their clientele to have that option. But ultimately, it's up to the insurance carrier.
So there wouldn't be a turnaway for private insurance?
If their insurance isn't taken at that facility, then yes, they would be turned away.
Well, then that's something that obviously is a board of supervisors, in their realm of decision making.
Right, and of course, there could be a caveat put into, it's something that could be a decision that Measure B has some operational funds that cover that clientele, but it would be non-reimbursable, and it would be 100% paid through Measure B funds. So our hope is that private insurance companies will come to the table and contract. Yes.
At least with Adventist Health, and my understanding is Blue Shield isn't contracted anymore. That's, but it's all a question of dollars and cents and negotiation about how much is going to be paid. So it's not just some insurances do and some don't. It's just a question of whether they're going to pay enough to make it worth our while, and we're going to accept low enough to make it worth their while.
And
It's
also,
it's a money
my
game.
understanding, yeah, it is, it's always money. But my understanding is also that if you're on Medicare, they are not denying the supplemental that's Blue Shield.
But Doc, if somebody goes in with Blue Shield right now to Adventist with a broken arm, Adventist is gonna fix her arm.
Yes.
Because that's what basically the law is for the emergency room. Not if they want to have elective surgery, but emergency. And the PUF is a psychiatric health facility for emergency 72-hour commitment. So I'm not trying to waste your time here. This is a battle that I'll gladly take up with the board, the supervisors, to say, we're building a PUF for all the people, not just for people who are on Medi-Cal.
And we're not building it for Tom on Medi-Cal. The problem is this is what happens. You're going to get the bill.
That's right. It's a question of who's going to
It's a question of who's going to pay. And I feel like if the person wants to say, yeah, put me in there and I'm going to pay the bill, then that's fine. But it's really unfair when someone's in a crisis to put them somewhere and then they get a $10,000 bill. That's not fair, right? And so, yeah, they go into the emergency room and they're not taking their insurance. Aventis is any emergency room is going to send you the bill and you're going to cover the cost, and you're not going to get the negotiated insurance rate cost, you're going to get the full cost. And so that's why when people get placed in psych facilities, they really do try to work with a facility that matches your insurance, because there's nothing worse than having a crisis and then getting, imagine you're going to get the $1,500 a day. Some facilities are $2,000 a day. You're there for 7 days. And that doesn't include the physician's fee, right? Because then you have the physician who bills opposite of the psych facility and the ambulance cost. And so that bill goes to you. Right. So that's why. I mean, it's really, I hear you, and that's why we need to push for all insurance companies to accept and use this facility. And I think that's something we can push for, but I also don't ever want to put someone in a situation unless we have another funding stream to get a $20,000, $25,000, $30,000 bill.
And I appreciate it. I just want to have a conversation. So when we do swing the doors open, there's not a surprise with people saying, only 60% of our population is going to be able to go in there for whatever reason.
And that wouldn't be, and we should look at that. I can bring some numbers back. 75 to 80% of our population that ends up in facilities are Medi-Cal. And then you have your Medicare. And we can look at those numbers. I mean, that's something to look at. my goal is that that facility gets every insurance company to contract with them, because that would be ideal.
But as for an emergency room, like you said, they have to take anybody who comes and they have to do the work. If it's somebody who has no money and no insurance, they might take a loss. I don't know what it's like with a PUF.
Yeah, they bill you.
So go ahead.
Sorry, I've been through parity issues with a family member, and yes, you will get a bill. And it's not pretty. So the idea of potentially having a different funding stream down the line that could offset costs, and having a facility here locally especially that accepts all insurances, or is at least trying to make that happen, like, that's incredible. Yeah.
So this is something that would require a lot more work and research, but if you're looking at funding for a non-indigent population, that is people who have the money and the resources to pay the bill, we may have to look at what funding sources can be used and whether we run into gift of public funds issues. Essentially, if it's outside of the statutory charge that the board has to fund for the care of indigents.
So I have two parts here. At the bottom I had, because we haven't ever seen an agreement, I know there was a RFP submitted by Telecor, is that their name?
Telecare.
And we haven't ever seen that RFP, and I wonder, just had to put some ideas down here, beyond selling 4 beds to out-of-county entities, making an agreement with the vendor that you pay a certain amount per bed for beds 1 through 12 and a lesser amount for beds 13 through 16. The county only pays for beds per day that it actually uses. Those kinds of things. I don't know if those are things that can be negotiated.
You can, but you probably won't get a provider.
Really?
Yeah.
Okay. And then the last other part is I would love some clarification on that, the part that I talked about related to supplanting versus supporting or expanding. Because do you have a number how much the county currently pays for PUF services, excuse me, to send patients to facilities because we don't have them?
Yeah, we have a number. I would want to break it down because my number would include youth, and this facility won't take youth, right?
Right.
So I can break it down of how many adults and what was the cost we paid. But like I said, it's going to be probably between 2.5 million. It might be a little less, especially when we only have adults. But that's that 40%. So on your number, Sherry, 1A, that's the county's share. That's the only dollar the county pays, that 40%, which isn't really a 40%, right?
Right.
It's whatever whatever the negotiated rate is with that facility and Medi-Cal's new negotiated rate. So that's the rate. That's when you talk about supplantation, that's our share to pay. So you already put it in there. The county would pay 40%. That's our share.
So
that's what we pay currently.
So if that's the case, then when our budget shows $1.8 million for operational costs for the facility, for the PUF, what would that be for then?
You have your, it's a variety of things. It could be out-of-county indigents that walk in that we may not be able to bill another county for, that we had to put in the facility. It could be things like their cost might be more than what Medi-Cal and the 40% reimburses, right? Every year their costs go up. So you have a different thing. We agreed that knowing that we were doing a super PUF, the cost was going to be more. So just because I think Ace said it, we may have to take Blue Shield, and Blue Shield may say, you're going to pay me $1,500, but you know, you're only gonna get back from, you know, what they negotiate with us. So it's $1,500 for their, you know, let's say the cost is $1,500, they're only gonna pay us $800 of that. How do we absorb the additional dollars, right? That's how insurance works, right? We're
Right.
gonna have our daily operating
Right.
costs, but we may not
Right.
get paid our daily operating cost. So you've got to include that into your buffer of your budget.
Right.
And then
right.
are you operating at 100% full? Because there's no guarantee this facility is gonna be 100% full every day. So then you have to take in those days you might take a loss.
And I know that with other forms of insurance, the easiest, what comes to my mind is dental insurance. Whatever's not covered, you pay out of your pocket. And is it,
But with insurance, remember, it's a negotiated rate. So as a member,
Right.
you get the negotiated rate. Even if the service costs $1,500, they
Right.
negotiated, they're only gonna pay $800. You don't pay that $800 to $1,500 difference. You pay your copay of the $800, right? So there's still a loss to the facility. So those are the things that you have to take in. And then you just have to take in, you know, not being 100% filled, plus any damage that's done to the facility. There's a lot of things that go in that are going to be cost to that facility.
so if it costs $1,500 a day and the insurance covers $900, the county swallows that $600 difference?
If
Is that what
that's-
you're saying?
so,
Is
yes.
that how it would be set up?
Yes, that's how insurance works. It happens in the hospital all the time, right? So
why there's the thing going on right now.
so if, Ace, yeah, go ahead.
But you know, it's horrible. You know what happened, there's one guy that I know that didn't have insurance, and he went and he talked to them at the lab because he needed some lab tests. And they said, if you're paying cash, you get 60% discount or something like that. And he said, how much will that be? And they couldn't even tell him. But if you had insurance, the cost for the insurance would be less than that, than you'd pay for the 60% discount. You know, it doesn't make any sense, and it's not really,
So how do you determine, though, if someone walks through the doors who's quite well off, and that person's insurance only covers $900?
But
The
remember-
county won't request that they...
Insurance negotiates a rate with the facility, right? So let's say you have to go in and get an MRI, or you're in the emergency room, your bill is $11,000. Well, there's negotiated rates that are lower than that, right? So your insurance already has negotiated, like, okay, you want $1,000 for that, we're gonna pay $300, right? So they negotiate what you're saying, this is
Right.
what it cost me, they're gonna say, this is what we're gonna agree to. We can't then bill the patient, oh, well, your insurance only paid $300, you owe the other $7. All we can do is say you owe 20%, if that's your copay, of the $300. So then the facility takes a loss. That's part of that negotiation with insurance companies. You're gonna say, this is what that cost, they're gonna say, okay, this is what we're willing to pay, right? If you've ever seen your EOBs, your explanation of benefits, you'll see this was the actual cost, this was negotiated, how much they paid, and then that's what they paid, right? And then your share of costs. So you always have your negotiated rate.
Right.
If I could add an additional layer of complication.
Go right ahead. Add to it, Christian.
So everything that was described, I think, is an accurate statement as to normal practices within the healthcare industry, and that there is a lot of what we would call price discrimination, that essentially not every customer pays the same amount for the same service. When we are in government, we do have a Prop 26 issue that can come up with respect to, we may not be able to engage in the price discrimination in the same way that a private industry may be able to. Now, that doesn't mean it's necessarily going to affect operations with the PUF, because depending upon how we may structure it with a private provider, and then the private provider is actually the one that's engaging in the price discrimination, and then some of our real estate sorts of transactions are exempt under Prop 26. But it's not quite as simple as saying the county eats the loss, because that might have to be structured into the larger agreement and then with the private provider as to what that looks like. and what we're contracting for and what we're paying for in that context. But the price discrimination between the insured and uninsured in the medical industry is very, very common. And we also may want to talk, frankly, to those counties that operate hospitals just to make sure that we're in line with the best practices related to insurance billing and Prop 26.
And most counties operate at PUFs at a deficit. That's what happened before, right? So we know that's why we added a service, a 25% service, knowing that we may operate at a deficit, and we didn't want to not be able to operate the facility. So then you have to look at how do you cover that potential deficit. The provider isn't going to come in and say, oh yes, I'll come in and I'll take the deficit. They're going to say, this is what it cost me to operate this facility. Either you're going to pay it or not, and they're going to subtract from what they get reimbursed. So, we're in this place where we do have to plan that there could be a deficit and operational costs that Measure B has to cover, which is why we had that 25%. We've always, I don't think there's anyone who's been on here sitting since the beginning that we hadn't had those conversations where we knew it could operate at a deficit and we needed to have funds to be able to cover that deficit. Yeah.
I would just recommend, if this board wants an in-depth training on healthcare billing, which is very difficult and complicated, not to mention to add in behavioral health billing into that as well, that you may want to schedule it for a future meeting, because you are not going to solve it at this round table. I've taught it for years. I did it with the hospital for years. It's a lengthy conversation.
And if a motion is needed to never have that conversation, I'll make that motion because obviously we're getting to the minutia here, but I'll tell you this, and it's heartfelt, the fact that we're having a conversation about having a PUF, a genuine PUF, and we're talking about funding it, and we're talking about reimbursement, it's about 1,000,000 miles ahead of where we used to be. So we don't need to banter the insurance much, and I appreciate what Sherry did here, but we're making progress.
So if we go to the second page, where this is a very rudimentary budget, projected annual revenues and annual interest total about 2.3 million. And if we use what's currently projected for our approved projects, there's the 1.8 for the PUF, assuming I had question mark, is the CRT self-sustaining? We've got the training center, mobile outreach, CS, the NAMI contract, and the respite, Fort Bragg crisis respite. That totals over 3 million. So our current revenues won't cover that.
So Sherry, just for some history, I just wanted, just some history. The original agreement for, and we would have to revisit this at that time, but the original agreement for our outside projects was for 4 years.
Right.
And the reason was because we knew after 4 years we were going to have to fund the psychiatric health facility, and that was going to be our priority. And that's what we talked about at this committee several years ago. So I would not assume in our cost the additional projects, because we hadn't voted at this time to extend them past the 4 years, because we only agreed to 4 years knowing we needed that revenue to sustain the psychiatric health facility. And I would remove the NAMI contract because that's no longer in the works. But the original, besides, the regional training center, that should be there. The rest of them were only for 4 years, specifically because we knew when the PUF opened, we needed to maintain those funding for the psychiatric health facility. Currently, the CRT is self-sustaining. That doesn't mean it wouldn't change, but currently between the realignment dollars, the Mental Health Services Act dollars, and the Medi-Cal dollars, we are able to sustain that facility currently without needing additional funding from Measure B.
So is it, last thing, not to beat a dead horse here, but that's a terrible expression. Is it possible to get something to support where that 1.8 million comes from for the PUF?
But that's not our role. That's the board of supervisors' role. That's entirely out of our realm.
No, it's connected.
Well, it's
Let me
connected.
finish.
Okay.
It's connected because these are 4-year contracts, and when you're making a decision about whether to continue to fund other programs, how much you pay for the PUF makes a difference, whether or not it's affordable to fund the other programs.
Of course it makes a difference, Sherry, but this board doesn't, that's outside of our realm. It's a concern as a taxpaying citizen, but not as a member of the Measure B Advisory Board, because we're an advisory board and advising to the board, and the board gets to make these great decisions. So it's a concern. It doesn't keep me up at night because I trust our board, but it's a concern. But it's outside of the responsibility of us.
So any of these other projects, there's someone comes to us, the Fort Bragg Crisis Center comes and wants to continue funding. How do we say yes or no if we don't have the funding, the big picture? We can't answer a question like that.
We don't. The Board of Supervisors do.
But we can make a recommendation. That's our job. We don't make the decisions. We can recommend though. And that's important. How do you make a recommendation as a board member here? What do you base it on? That was one that's what drew me in at the very beginning when I was just a member of the public and I would see things come before the board that cost money and I would say, how could they decide yes or no without a big financial picture? Anyway.
My understanding is we're advisory. And we go to the Board of Supervisors and say, we presented this, we think it would be a good idea, and then it was up to the Board of Supervisors to go, yeah, that is a good idea, and how are we gonna fund it? And they pull it from wherever they think they need to. That's just what happened just now with the Ford Street and the jail. The jail we needed to finish. And so the decision was made to do that before funding Ford Street. But that was the Board of Supervisors. We told them what we thought, but they did what they thought was best.
And so what happens when Fort Bragg comes and says, we want to continue beyond 4 years?
Well,
What kind of recommendation? I know we're not making decisions, but what kind of
but
recommendation?
how can we recommend something for the future if we don't know what it is? We don't know if Fort Bragg's gonna come to us. We don't know who's gonna come to us. The last one that came to us that we still have on our agenda is Ford Street. But do we have other ones? I don't know. But it doesn't mean they won't come to us, but how can you get a crystal ball and make decisions about stuff we don't know anything about?
No, that's what a budget is. It is a crystal ball, and that's the only information you get to work from.
Yeah, Darcy.
Chair, you have over 55 minutes left and we have 40 to go. I have a meeting and I believe a couple others do at 3. So is there action to be taken here? It
No,
doesn't
this was just an update and a discussion. And I will say, just to wrap us up, in case I will ask about public comment in case we have any, but that was the plan of the long-term fiscal plan, was to determine what that looks like. So hopefully when that plan's done, and the committee agrees on it, maybe we'll have a future plan. I just want to know, it'll always be an estimate because the costs go up every year and the cost of doing business goes up every year. So we're never going to have 100%. Is there any public comment? All right, here, seeing none, I'm going to move on to item 3G, prudent reserve, and this is a discussion-only item also.
Again, this is my experience in creating a prudent reserve as a finance director for a school district was the reserve gets created in a year based on the budget. At the end of the year, there's a new budget, a new reserve is created based on that budget, but it's not rolled over. And in Measure B, the reserve is being rolled over. The county doesn't roll over its reserve, and I'm wondering why Measure B is doing it that way.
Can I just ask a question, Sherry? So, I sort of understand your question, but what I'm trying to figure out is, do you not want monies to stay in prudent reserve? Or, because this is for 20 years of maintenance. So do you not want it to roll over? That's what I'm asking. What's your,
What's my agenda?
yeah.
My agenda is to find a way to fund Ford Street. That's my agenda. And having money sitting in a reserve not being used doesn't seem like a wise thing when Ford Street is so important to our community.
Go ahead, Joe. I always defer to you. Go ahead.
I don't know why. Ford Street is important, I agree, but a reserve is there for emergencies. So if everything stopped tomorrow and we still had bills to pay, that reserve would pay those bills and it would be able to close down the business. That's one of the things that we did with the Tourism Commission. We were told by the Board of Supervisors we had to have reserve to finish our business if something changed. And we will always have to finish our business for this. Prudent reserve is prudent to cover your patoot. And I see it as, and that's pretty simplistic, but I see that as necessary. It's not money in abeyance to use, it's money to cover your patoot when something is an emergency.
Donna?
Exactly. It's just like being in private as a homeowner. You don't spend all your money on your mortgage. You have to have a prudent reserve for if your roof goes bad, if the refrigerator goes out, if your tires go out on your car. It's the same thing. It's just government. So if you don't have, and as you all know, I pushed for even adding more money to the prudent reserve because you have 25 years of maintenance. Where's the maintenance coming from? There's nothing in Measure B for maintenance. That's your prudent reserve. That's for things that go on. Anyone knows that you have to have money in savings to take care of things. And the rollover, I'm not sure about, but it should be.
Ours rolls over.
It should roll over. And as you all know, in my opinion, our prudent reserve should be way more than it is. But that's my opinion. So I'm not sure Ford Street is important, but I do not think we can steal from the prudent reserve. That's my opinion.
But that's exactly what we're doing for the jail.
That's not us.
According to what they said about the jail, there is something coming to pay it back. Now, Ford Street, we want to give the money to. Are they going to pay it back? Can we make it a decision?
No, it's not. No,
Well,
of course not.
So Sherry, what I'm saying is, you can't rob the business to do something you can't afford. And I may not agree with how this was done, but it's still for behavioral health. It's still for mental health. And, it still needs to be done. But to take from our reserve to pay for something we still want, it's like, I might want a new car, but I can't afford it. Right now, we can't afford to do Ford Street. Maybe we will in another year, who knows? We don't know what we're gonna get back, and we don't know about I'm sorry, just blanked on my, I'm like, but we don't know if we're gonna be getting money from other places.
But we've agreed to a loan, $7 million loan for the jail. A loan.
That's to our own county.
Yes, I understand that, but it's a loan out of Measure B funds.
They're gonna pay it back.
That money will get paid back.
Then we can give it to Ford Street.
And I don't know what the timeline for the Ford Street project is, so that's why I'm curious to know and it's on the agenda, what is the timeline for paying back that $7 million loan? Is it possible that the reserve could be lowered for a little while? I don't know what the timeline, like I said, for Ford Street is, but to be able to fund them.
I would never agree to take money out of the reserve.
But we're
Honestly.
doing that for the jail.
But the
That's-
jail is
it's
paying it back.
600? Okay.
Donna?
Sorry. First of all, Sherry, we are not doing that. The Board of Supervisors is. So that we need to clarify. We are not doing it. Secondly, if you want to borrow from a prudent reserve, it takes a special meeting to do that. So the Board of Supervisors is going to have to do that if they want to take from our prudent reserve. They're going to have a special budget meeting. So that's kind of off the table until they do that, in my opinion. So that's all I have to say.
And I just want to clarify, no one's taking money from the prudent reserve. So the analysis shows what it would cost if money was all paid out today. That money is not being paid out today. That's just showing when we created those budgets, it's like, here's everything that's allocated. That fund has not been taken out. Nothing's been taken out of the prudent reserve. The PUF is going to take, as I think Tom said, several months to build, so it won't even all come out at once. And so with the grant funding coming in at the same time, it's going to offset that dollar amount anyways. So we won't be touching the prudent reserve at any time. Unless for some reason something goes haywire, but the way Mary Alice set it up, it's not to show that we're taking $1 out of the prudent reserve today. You guys asked to see how much money we have allocated at any given time, and it's just showing how much we have allocated to projects, not what we've spent, right? So if we actually looked at what we spent, we haven't spent half of the PUF dollars at all. So we haven't touched the prudent reserves, and we won't touch the prudent reserves.
There was enough money unallocated for facilities before the loan was made for the jail to fund Ford Street.
Right, I agree, but that was a decision the Board of Supervisors chose to fund the jail project versus Ford Street.
Madam Chair, so I don't mean to say that the committee can't discuss this. Certainly you could make a recommendation, but I would suggest that you might want to consider the use of your time, and you may want to look and review the board discussion, the board action. I think this may be rehashing some of the discussion that had at the Board of Supervisors, and there was a decision that was made at the end of that. So you might want to consider whether it's the most efficient use of the committee's time to be making a recommendation on something that has been acted on.
And we can't make a recommendation today anyways.
Okay.
So, all right, any committee comments? All right, any public comments?
Yeah. John Haschak, 3rd District Supervisor. So I think that what Director Ebyam is talking about is when you look at the prudent reserve, and I finally, because I've talked to her about this, I finally kind of saw the light myself, I think, is that when the committee said we were going to do 6.35% as a prudent reserve, and if you look at overall revenues was 49 million, that was stated earlier in the meeting, then you would think 6.35% of 49 would be somewhere in the ballpark of 3 million. And when we have 7.8 million in prudent reserve, because of this carryover or whatever, I think that's the basic question. Is like, are we going to carry 7.8 million in prudent reserve, which would be about 16%, or are you trying to keep it at the 6.35? Whether, and that difference, whether it's 4 million or whatever, if it goes into unallocated, if it goes to the jail, those are all questions beyond this, but the basic question is, what is a prudent reserve?
Do you mind, Supervisor, if I ask you what you think a prudent reserve is? As a board member, how you as a county?
Well, I would think that, if it's 49 million in revenue, you take 6.35 of that, and then you got your prudent reserve.
Okay.
mean,
Thank you. I
maybe I'm
was asking how you as a supervisor would use those funds and how you think those should be carried forward, because you're going to have maintenance of your buildings, you're going to have certain things, and everything's going up as we keep moving.
You know, I totally agree that we have to have that capital improvement fund, you know, and all that. It's just that, what are we doing with the prudent reserve is the question.
Unfortunately, yeah, and I think that's a question, Supervisor Hashtag, we have to go back, because this committee decided not to move forward with the capital facilities reserve because they lumped it into the prudent reserve. Because the prudent reserve is at 7, they lumped those two and decided last meeting not to move it forward. So I think if we do make a decision on the prudent reserve, we have to bring the capital facilities reserve back too.
Okay,
Because we didn't move that forward last meeting because of the amount in the prudent reserve. We all said that could cover as the capital facilities reserve also. So we would need to bring it back, I think. Yes, Tom?
I have a question for council. Just because we make a recommendation on our budget for a prudent reserve doesn't mean the board of supervisors has to have a 4/5 supermajority vote to take money out of the prudent reserve, correct?
That is correct, except at the time that they set the annual budget. At that point, it's a simple majority.
Right, but a 3/5 vote of the board could use money, could take money from what we say is prudent reserve and use it towards Ford Street or anything they voted on, right?
Correct.
Thank you.
Thank you, Tom.
I think, Jackie, were you going to speak?
Jackie Williams, I'm the Executive Director of Ford Street. The way I view where we are is the decision has been made. Ford Street was not approved, the NOFA, the application was not approved, and I don't want to say dead in the water, because Ford Street's not dead in the water, but this issue is dead in the water. So we are working hard to figure out what we're going to do, and the thing I wanted to mention to you today is we have elected to close our sober living environment so we can begin to serve the extra withdrawal management people. And that will be effective February 1st, just because the need in our community has climbed to the place that we don't see it falling off. So I do appreciate your concern for us, but I think our county has a bigger issue where we can contribute, and that's providing the withdrawal management. It is true that we are still looking for the $2.6 million to finish sober living, but right now our most urgent issue in front of us is trying to figure out how to offload folks out of the ER, the people that we can serve. So I also think it's important to understand that although your review committee moved forward with a police supported or a supportive message, there was real dissension across the Board of Supervisors. There's still, in my mind, a real lack of understanding of how you serve mild to moderate people and if that's even a need. So I think if we were to go before them tomorrow, I don't know that we would gain three votes. There were people were all over the map on this one. So again, I appreciate the time that you spent reviewing and moving it forward, but I think for now, it's kind of a done deal.
Thank you, Jackie.
Ms. Williams, can I just confirm, did you say you're converting your SLE to detox?
Yeah, the 18-bed SLE. So we will go from 6 withdrawal management beds to 18. We have to house the people that are currently in there. And so, and the state has planned a visit to sign off the increase of our license, but that will happen 2/1.
Thank you.
Any other committee comments on the prudent reserve? I just wanted to add one last comment that we remember when we talk about our prudent reserve, it is split 75-25. So just to make sure you remember that even when we talk about it, it's not 100% capital facilities, it's 75-25. So.
And I just want to clarify, I was not advocating for no prudent reserve. I realize the importance of a prudent reserve.
Thank you, Sherry.
All right, we're going to move to 3H, details of loan from Measure B to the jail. Sherry, I think this is you too.
No. Well,
I think you wanted to know, yeah.
What is the, plan for paying back the money that was loaned from Measure B funds? To the $7 million, is there a plan for how that will be repaid?
I will ask Member Antle if she would like to
Guess
speak
you're
to that.
asking me. We haven't acted on the loan yet, and I'm waiting as long as possible in hopes that there's other funding available. Once we do, we are looking at an interest rate, which, as County Council reminded us, we are to pay. That's a tough nut on $7 million to have to figure out how to pay that back. We do have some options in the future, depending on when this funding is needed for the jail, similar to the PUF, when we pull it and when we need to use it. We hope to start the jail project once we get our final approval from the state, which I believe is next month in January of '24, and then we hope to begin work there. We have several millions of dollars set aside for this project already. If the state says we have to have it all in one bucket, we will do that sooner rather than later, but I would prefer to wait till later because of the interest rate. If you look at the county budget as a whole, I don't see many opportunities on being able to pay that back until the jail is complete, which would take at least a couple of years to finish, or the behavior wing of the correctional facility. And then we would start paying that back. So say that's 27 when we start paying it back at an interest rate of roughly 2%, that's over $1 million back to Measure B. My hope is that what I know, and it's up to the Board of Supervisors, is that our pension obligation bonds that the county's been paying close to $8 million on is the last payment is in July of '25. That a portion of that money then can go to start paying back the loan towards this, towards the Measure B loan. But again, those things, we still need to work those out. I will have to work with that acting auditor controller to finish out those details.
All right, any committee comments? Any? Yeah.
Assuming, Darcy, that all has to go through the Board of Supervisors.
Oh, absolutely, absolutely.
The whole, yeah. Yep.
Any other committee comments? All right, any public comments?
Yeah, John Haschak. And, over the last month, I think CEO Antle and I have been in several conversations trying to find out if there's money out there. And I think Dr. Miller has been in those conversations too. We're looking all over the place for any pot of money out there with the state that could help to pay off this extra cost, the overrun for the jail. And that would take, we wouldn't have to borrow the money from Measure B in a perfect world. Thanks.
Any other committee comments? All right, 3I, follow up on Ford Street request for proposal. Sherry, that was yours. Okay, you want to say we've done it? Okay, any questions or comments on that since we're kind of moving past it, but I want to make sure? Any public comments? All right, so we will do a committee member report out. If we want to go around the room, Tom, you want to start? Do you have any committee member report out?
Nothing to report. Happy holidays, everyone. Thank you for serving on this committee.
Sherry?
No, nothing.
Happy holidays, and I hope 24 is better than 23.
Why do you say that? Nothing to report, but happy holidays, whatever you celebrate, and happy 2024. See you next year.
I have nothing to report. Happy holidays also.
No report.
No report.
Nothing to report.
All right, so before I end, I will just add, Sherry will be chair next year, and we will need to pick a vice chair in February, so
Throw your hats in the ring.
yeah, throw your hats in the ring, and we will see you guys in
Wait, I
February.
know we're really leaving. Mary, I'm making a motion outside of our meeting that you've been the best numbers producer and documenter that we've had. Thank you very much. Good luck with retirement. Thank you for what you've given us. Thank you very much.
I appreciate that, thank you, but I just have good people to follow, and I have a great person to follow me, so thank you.
Good luck.
And if you're bored with retirement, you can always sit in on these. There's only going to be 4 of them.
I have a lot of painting to do.